Hello, and thank you for joining Oakland Community Health Network and this training about communicable diseases and prevention. I'm Susan Stevens. I'm a registered nurse. I work at Oakland Community Health Network, and I'm a nurse case manager. The purpose of this training is to help individual organizations determine the level of training needed for their staff depending on their position and job responsibilities, upward movement in terms of skill competency for staff, and to coordinate primary care needs for people who are living with intellectual or developmental disabilities or persons who are severely mentally ill. Learning objectives include identifying types of communicable diseases, to discuss prevention, treatment, and vaccinations, discuss why integrated care is important, and to review IPOS goals related to communicable diseases, and to review resources available. What is a communicable disease? This is also known as an infectious disease. It's an illness caused by bacteria, viruses, or parasites. And communicable diseases can be spread through bodily fluids, contaminated surfaces, air, animals, or food. Some spread during particular seasons, and others may be year-round in certain locations. Now let's watch a video about communicable diseases.
We're going to have a look at how infectious diseases are transmitted and a few different ways to control their spread. First, let's have a look at how people can get infected with these diseases. In general, there are three main components that need to interact with each other for an infectious disease to occur. This model of infectious diseases causation is called an epidemiological triad. The first component is the agent. This is the organism that causes the disease. It can be bacteria, viruses, parasites, or fungi. Second is the host, who is the target of the disease. The third component is the environment. This refers to the surroundings and conditions that are external to the host that allows the disease to be transmitted. In addition to these three components, transmission pathways between each of these allow the spread of infection. These transmission pathways can be direct or indirect. In direct transmission, the organism is transmitted directly to the person. This could be through touching, sexual intercourse, coughing, or sneezing. On the other hand, in indirect transmission, the organism is transmitted via an intermediate. There are several ways that this can occur. It can be through contaminated objects such as toys, soiled clothes, or even through food or water. It can also be through an intermediate vector such as a mosquito or a tick. Now that we know how infectious diseases are transmitted, let's have a look at how to control them. Changing behavior can reduce or eliminate the risk of exposure to an infectious agent and prevent their spread. There are many different and sometimes simple health behaviors that can be adopted, including using condoms to eliminate or reduce the risk of sexually transmitted disease, regular hand washing, having a healthy diet, or using insect repellents. Behavior change is an important target of health promotion programs. Vaccines are one of the biggest successes of public health and have led to reductions and in some instances eradication of infectious diseases. Routine immunization of children has led to a dramatic decline in diseases like measles, diphtheria, and pertussis, saving countless lives. Vaccines not only protect the individuals, but by increasing the level of immunity in the community also protect others. This is called herd immunity. Medication has been one of the mainstays of managing infectious diseases. Antimicrobial medication work by either killing the microorganisms or inhibiting the replication. They're not only used in treating diseases, but in some situations can also be used to prevent infections before or after being exposed to a disease, pre- and post-exposure prophylaxis. A significant issue in the fight against microorganisms is antimicrobial resistance. This can happen when microorganisms develop resistance to drugs that were once effective against them. Antimicrobial resistance has been accelerated by the inappropriate or excessive use of antimicrobial drugs and has become a significant issue in the fight against microbes. Surveillance is a tool that is used to control infectious diseases. It is used to monitor diseases and their trends, characterize patterns of disease, and detect outbreaks. Surveillance can also guide the prioritization, development, and evaluation of disease control programs. In most countries, there are a number of diseases or conditions that are required to be notified by law. These are called notifiable diseases. Laboratories and doctors routinely send information to health departments who monitor them and act accordingly. Modifying the environment is another way to control infectious diseases. This includes activities like vector control, which is the eradication or control of vectors that can transmit diseases like malaria and dengue, ensuring that there is safe water supply, which leads to a reduction in waterborne diseases like cholera, Cryptosporidium, and hepatitis E, and improving sanitation facilities and hygiene, which can reduce the spread of diseases like Shigella, hepatitis A, and Salmonella. Other environmental measures include improving housing and working conditions, ensuring food safety, and enhancing air quality. Infection control in healthcare facilities is important because infections can spread quite rapidly in these facilities if proper precautions are not taken. Ways to prevent the spread of infection include proper sterilization of equipment, wearing appropriate personal protective equipment, isolating infectious patients, strict hand washing practices, regular cleaning, and having a good hospital surveillance system so that these infections are recognized and managed early. There are various other factors that contribute to the control of infectious diseases. These include broader measures like improving the social determinants of health, such as education and employment, having strong healthcare systems, and having an effective health workforce. Finally, the One Health concept recognizes that human health is closely connected to the health of animals and the environment. Therefore, successful control of infectious diseases requires the cooperation and collaboration of many specialties, including veterinary and environmental sciences. So that's a quick overview of controlling infectious diseases. We've taken a quick look at how infectious diseases are transmitted and a number of ways to control their spread.
Here are some common types of communicable diseases: hepatitis A, B, and C, tuberculosis, meningitis, bed bugs, scabies, shingles, impetigo, chickenpox, ringworm, and there's many more. Hepatitis A is a liver infection caused by the hepatitis A virus, and this virus is found in the stool and blood of people who are infected and can survive, and this can survive also in services for several months. Hepatitis A is very contagious, and people can spread the virus before they get symptoms such as nausea, stomach pain, and yellow skin or eyes. There is a test and a vaccine for hepatitis A. Hepatitis B is a liver infection caused by hepatitis B virus. It spreads when blood, semen, or another body fluid from a person infected with hepatitis B virus enters the body of someone who is not infected. Now, this happens through sexual contact, sharing needles, syringes, or other drug injection equipment, or from mother to baby at birth, and there is a test and a vaccine to prevent hepatitis B. Hepatitis C, and this is a liver infection caused by the hepatitis C virus. It is spread through contact with blood from an infected person, and most people become infected with the hepatitis C virus by sharing needles or other equipment to inject drugs. There is a test for hepatitis C, but there is no vaccine. However, there are treatments available for qualifying individuals through liver specialists. Human immunodeficiency virus, which otherwise known as HIV. This is a virus that attacks the body's immune system. It spreads through sex or by sharing needles or other equipment to inject drugs. If HIV is not treated, it can lead to AIDS, which is acquired immunodeficiency syndrome. There is currently no effective cure or vaccine. Once people get HIV, they have it for life, and they usually take medications daily, ongoing, the rest of their life. Tuberculosis, also known as TB for short, it's caused by a bacteria called Mycobacterium tuberculosis. This usually attacks the lungs, but TB bacteria can attack any part of the body, such as the kidney, the spine, and the brain. And not everyone infected with TB becomes sick. And if not treated properly, TB disease can be fatal. There is a vaccine for TB, but it's not often used in the United States. It's used in other countries for small children where TB is more common. Meningitis. This is an inflammation or swelling of the protective membranes covering the brain and the spinal cord. There are several types of meningitis, such as bacterial, viral, fungal, parasitic, amoebic, and non-infectious. Meningitis is caused by bacteria that can be deadly and requires immediate medical attention, and vaccines are available for some bacterial types. Methicillin-resistant Staphylococcus aureus, also known as MRSA. Now, MRSA is a type of bacteria that is resistant to several antibiotics, and it may appear as a skin infection, like a boil or an abscess, or cellulitis, which is inflammation in the tissue and a swelling of the area. It's found in urine, in the respiratory secretions, and in blood. And anyone can get MRSA, but the risk increase with activities or places that involve crowding or skin-to-skin contact and shared equipment or supplies. Rubella, also known as German measles. This is a contagious disease caused by a virus. Transmission is airborne or direct contact to droplets of fluid from the mouth, nose, or eyes, and it may cause a 3-day rash, fever, headache, achy joints, and enlarged lymph nodes. It is prevented with the MMR immunization. Chickenpox is a highly contagious disease caused by the varicella zoster virus, VZV. It can cause an itchy, blister-like rash, and it can be very serious, especially in babies, adolescents, adults, pregnant women, and people with a weakened immune system. There is a chickenpox vaccine today. Shingles, reactivation of the herpes virus that has been dormant since previous episode of chickenpox. So that means if somebody had chickenpox later in life, they might be likely to get shingles. That doesn't mean everyone will get it, but there's a risk that you could get shingles. Anyone who had the chickenpox in the past can just develop it, and even children can get shingles. Now, shingles cannot be passed from one person to another, but there is a vaccine for shingles. Herpes simplex, which is a cold sore. Now, these are caused by certain strains of the herpes virus, and it's extremely contagious. It's transmitted orally and through respiratory droplets. There's no cure for cold sores, but treatment can help manage outbreaks. There's usually topical applications. There are some antiviral tablets you can take as well. But once you have it, it does take a certain amount of days for it to go away, usually about up to a week. COVID-19. This is caused by a virus called the coronavirus. It spreads from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. Symptoms include shortness of breath, fever, cough, loss of taste or smell. Can also have body aches. As of February 2021, there are 2 approved vaccinations for COVID-19. Remember to wash your hands frequently, clean highly touched surfaces, and wear a mask where applicable, and maintain social distance guidelines. Now let's watch a video about COVID-19.
Coronaviruses are a large family of viruses that get their name from the halo of spike proteins on their outer surface, which resemble a crown, the corona, under a microscope. The new coronavirus is called SARS-CoV-2. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. As a new virus, it means that previously no one in the world has been infected with it, and therefore, no one has antibodies to it. Because no one has antibodies, everyone is at risk for catching the virus, becoming ill, and spreading the virus. With the discovery of SARS-CoV-2, there are now 7 types of coronaviruses known to affect humans. 4 regularly circulate in humans and mostly cause mild to moderate upper respiratory tract symptoms that most people think of as the common cold. SARS-CoV-2 causes a disease called COVID-19, a severe respiratory illness. COVID-19 can be deadly, particularly for older people and those with underlying health conditions. The virus is spread through droplets in the air after coughing or sneezing, which people nearby can take in through their nose, mouth, or eyes. The virus can also spread by touching a contaminated surface, but it's unclear how long the virus lives on surfaces. Once inside your body, the virus travels quickly to the back of your nasal passages and to the mucous membranes in the back of your throat. The virus attaches to a receptor called angiotensin-converting enzyme 2, or ACE2, on respiratory cells in your body. The virus's genetic material enters your cells. The virus then hijacks your cells to produce copies of itself, which go on to infect more cells. The time between the initial infection and the first symptoms appearing varies widely, but is 5 days on average. Symptoms often start in the back of the throat with a dry cough and sore throat, along with a fever. Symptoms become more severe as the infection starts making its way to your lower respiratory tract. Here, it can cause more respiratory problems like bronchitis and pneumonia. When the virus reaches your lungs, it causes inflammation in the air sacs in your lungs, which are called alveoli. Your alveoli are where oxygen and carbon dioxide are exchanged. In pneumonia, there is swelling, decreased airflow, and your alveoli start to fill with fluid, causing shortness of breath and difficulty breathing. Some people need a ventilator to help them breathe. Less oxygen in your blood deprives other major organs of oxygen, including your liver, kidney, and brain. Acute respiratory distress caused by widespread swelling in the lungs stops your body from getting the oxygen it needs to survive. This respiratory distress can lead to organ failure and death. While COVID-19 can be deadly, the vast majority, around 80% of cases, are mild to moderate, and people recover within a week or two.
Impetigo. This is a contagious skin infection that usually is caused by a streptococcal, or known as staph, or streptococcal strep bacteria. It spreads easily among infants, children, and elderly. Use antibiotics to treat impetigo and prevent rare but serious long-term health problems, and that would be through your physician. Pinworms. This is an infection caused by small, thin, white roundworms. The small roundworms live in the lower GI tract and come out at night and lay eggs. They spread the fecal-oral route, and transmission can occur after contact with contaminated bed linens, clothing, toilet seats, sand, and food. It's treatable with over-the-counter or prescription medication. Athlete's foot. This is a fungus that grows on the feet, usually on the soles and in between the toes, and it's caused by a variety of fungi when there is excessive moisture or insufficient air circulation or abrasion. An antifungal cream or lotion or powder can treat this condition, and it's mildly contagious by direct contact and skin particles left on surfaces. Head and body lice. Lice are parasitic insects that can be found on people's heads and bodies, including the pubic area. They feed on human blood, and they spread most commonly closely by person-to-person contact. There's over-the-counter and prescription medications that are available for treatment. Ringworm. This is a fungal infection of the skin, and it's distinguished by a ring or rings surrounding the rash. It's treated by an antifungal cream, lotion, or ointment. It is very contagious, and it's spread by skin-to-skin contact. Scabies. This is a skin infection caused by a type of mite that burrows or tunnels under the outer layer of skin, and the mites, they lay eggs under the skin, and they feed on blood. It is very contagious, and it's transferred by direct skin contact. The skin becomes reddened, itchy, and blistered, and it can spread rapidly in extended care facilities and nursing homes. Bedbugs. These are small, oval, non-flying insects that feed by sucking blood from humans or animals, and the bedbugs do not transmit disease. They're commonly found where people sleep, like mattresses and bed springs, and the signs include small, flat, raised bumps on the skin, and a professional pest control company may be required to help identify and remove bedbugs. Gastroenteritis. This is a digestive problem that may be caused by bacteria, virus, parasites, drug reactions, food allergies, or consuming contaminated food or water. You want to frequently wash hands and avoid dehydration. Testing and vaccination. Inquire with your primary care physician's office, the staff there, for vaccines and testing available and coverage of the costs by your insurance. Medicaid and Medicare can cover most vaccinations, and the local county health department, such as Oakland County Health Division, has resources and information for cost of vaccinations and testing that's provided there. Their website's noted right there, and phone number. And there's pharmacies and health clinics in the community that also provide vaccinations. Here are some SMART goals for communicable diseases. First goal, in the next 2 months, I will schedule and attend an appointment with my doctor for vaccinations recommended. I will also ask questions I may have about the vaccinations. Goal 2, I will improve my health by exercising for 30 minutes at least 4 days per week for the next 3 months. Reminder, it is important for people served to regularly see a primary care physician regarding their mental health, medication management, and physical ailments to promote healthcare integration. Here are some national and local resources: the CDC, the Michigan Department of Health and Human Services for immunization information and for vaccines. Let's see, for myStrength, we just want to remind everyone that this is an application out there. It's on the web, or someone can use it on their phone, and this is available for anyone, employees or people served. And it teaches them about how they can help themselves and about their conditions for mental health and medical. Don't forget there's a quiz where you're linked into this video, and I'll just ask you questions what you just watched. And thank you so much for joining us. If you have any questions, you can contact me, Susan Stevens, at oaklandchn.org. There's my phone number as well. Thank you again.